So this is a great question that came in from one of our viewers. And no, I'm not referring to the thousands of comments asking me why I still haven't gotten a girlfriend yet. She asks, I had a full hysterectomy at 29 years old after suffering with endometriosis for 10 years. I have an amazing support system and the surgery went well. However, every time my husband touches me, I flinch. Even when we watch adult videos together, I cringe. It's been 3 months since the surgery, and I feel like I should be past this by now. Why is it still happening? What can I do? Hey there. Welcome back to the channel. I'm a urologist and pelvic surgeon, and if you're new here, I make urologic content regularly. So if you enjoy watching this, make sure you subscribe and share this channel with your friends. So if you've watched my channel before, you know I don't really talk about things like sexual function and issues because they're not really in the realm of what I do. But this is a great question, and one that maybe some of you may relate to. So I definitely want to discuss this. First off, I'm so sorry that you had to go through endometriosis for 10 years. That is a long time to suffer with something that is very painful and debilitating. And I'm glad that you finally got the relief that you needed by getting the hysterectomy. However, having major abdominal surgery like a hysterectomy can have significant impacts on sexual function. And what you're describing is actually very commonly seen after surgery. After any sort of abdominal surgery, we see women who have difficulty with reaching climax or orgasming. We also see people who have difficulty with vaginal penetration or even just discomfort with touch. This is usually due to a number of different factors. One is that there are adhesions or scars that can form in the abdomen. And as you probably know, right after surgery, they put you back together with sutures that are either absorbable or non-absorbable, and sometimes those sutures can remain there and cause discomfort or pain. Sometimes adhesions can form between organs or to the inside of the abdomen or to the bowel. And this can then cause pain when you're having intercourse, because during intercourse, obviously the organs move and shift, and if they're adhered together, that can cause pain. The other thing that can happen is that the nerves in the abdomen can be stretched or injured during the surgery itself. These nerves are called the pelvic nerves, and they come from the lower part of the spinal cord and go all the way down into the pelvis, and they help transmit sensation from the vagina, the cervix, the uterus, the bladder, and the rectum to the brain. So these are very important, and sometimes they get stretched during surgery. They also can get damaged during surgery, and sometimes people can have neuropathic changes, meaning they can have numbness or tingling or burning pain or discomfort in their genitals or in the areas around the genitals. In addition, sometimes people just need time to heal. You've had major surgery. Your body needs time to recover. And psychologically, you may also be having some challenges with intimacy or having a sense of self-consciousness or feeling kind of weird because you've gone through something so big. And lastly, some people will have what's called PTSD or post-traumatic stress disorder from having a surgery like this. In particular, if you've had a history of abuse or some sort of trauma in the past, you can have PTSD from that. And it can certainly affect your sexual relationships and your intimacy with your partner. So how do we treat these things? Well, first and foremost, you absolutely should discuss this with your doctor who took care of you after your hysterectomy. Make sure there's no actual pathology like adhesions causing this. And sometimes what we'll do is we'll do a laparoscopy and we'll look in the abdomen, and if there are adhesions, we can go ahead and take those off. That's a relatively simple procedure and usually can greatly improve symptoms. If there's no adhesions, then you may need to see a urologist or a gynecologist who specializes in female sexual medicine, and they can help you undergo some testing. There are some tests that are available to test sensation in the areas that are pertinent to sexual function, and if there are abnormalities in sensation, then they may perform a test called a penile Doppler ultrasound to see if the blood flow to the areas, particularly to the clitoris, is normal. And if it's abnormal, then they may refer you to a vascular surgeon to see if there's any vascular issues that are contributing to this problem. Things that can help overall are things like pelvic floor muscle therapy. So seeing a pelvic floor physical therapist can be helpful in regaining strength and control of the muscles that are deep within the pelvis and around the vagina and the urethra that can help support these organs. And sometimes if you've noticed that your symptoms are worse with certain activities or with being more physically active, then that may indicate that there's some pelvic floor spasm or overactivity going on. And a pelvic floor physical therapist can also help with that as well. Things that you can try at home include things like trying to lie down when you're having intercourse. Sometimes standing can make symptoms worse because it makes the pelvic organs drop and can aggravate symptoms. So lying down may be helpful. Also, changing positions may be helpful. If you're trying penetrative intercourse and it's really difficult, then maybe trying other types of intimacy like oral or clitoral stimulation may be helpful. And lastly, counseling or talking to a mental health professional can be extremely helpful because, again, you may be having some psychological issues related to this surgery, related to intimacy, or related to some PTSD symptoms that are affecting your relationship. So that can be extremely helpful. You may also be experiencing some vaginal dryness because you're no longer having estrogen stimulation to the vaginal tissues. And that can cause discomfort with intercourse. And there are things like lubricants that you can use. And there are multiple types of lubricants out there. You can use like an oil-based or a water-based lubricant. And there are many different kinds that you can try. You can try them during intercourse. Try one. If it doesn't work, go to the next. Find one that works for you, and you can find them at the drugstore or online. Lastly, if you're having difficulty reaching orgasm, which is something that many people struggle with for a variety of reasons, there are things that you can do to try to improve that. One is focusing on clitoral stimulation. Many women reach orgasm with clitoral stimulation rather than vaginal penetration. And there are things like pelvic floor muscle therapy exercises that you can do to help stimulate the nerves in the area that help you reach climax. So I hope this was helpful. Again, I'm sorry that you're going through this. It's not uncommon after surgery. It takes time to heal. So be patient with yourself. Try these things. And hopefully, over time, you'll get back to where you were before, or maybe even better. As always, remember to take care of yourself because you're worth it.